Oftentimes, we hear people call gonorrhea with all manner of names, such as a clap, a drip, or even in our local dialect, people call it babasokramai. Today, we are going to delve deep into the world of STI, sexually transmitted infections, and then talk about gonorrhea. We are going to talk about what causes it, the preventive strategies, and how to live with it. Actually, we can't live with it. How to cure it? We are going to explore that this time with Ms. Joycelyn. If you are new here, if this is your first time of watching my video, kindly give me a thumbs up by liking my video, sharing for me, and then subscribing to this channel. Thanks a lot. Stay tuned. Gonorrhea is an STI. It is a sexually transmitted infection that is caused by bacteria. The name of the bacteria that causes gonorrhea is Neisseria gonorrhoeae. Sexually active people of any age can contract gonorrhea and give it to their partners. You can also give the infection to your baby. You can pass it on to your baby, your unborn baby actually, during childbirth. And people give the gonorrhea to their partners through bodily fluids such as vaginal fluid or semen. You can get gonorrhea also from intercourse such as anal sex, oral sex, or sharing sex toys with an infected person. Gonorrhea is usually asymptomatic. It doesn't really cause symptoms. And that is why it makes it easier for people who have it to infect their partners accidentally. Sometimes they may not even notice they have the infection because it doesn't really cause symptoms. However, it is crucial for you to know your gonorrhea status, to get tested, and also use condoms during sex. This may reduce your risk of getting the infection. Gonorrhea impacts men and women differently. And like I said, it is usually asymptomatic, especially in the case of women. However, if symptoms are present, they may feel unusual discharge from the vagina that is white or yellow. This is in the case of women. They may also feel pain during sexual intercourse, pain upon urination, or bleeding between periods. Men are more likely to experience symptoms more than women. Like I said, it is mostly asymptomatic in women, but not the case in men. The symptoms in men may include a white, yellow, or green discharge from the penis, painful or burning sensation during peeing, testicular pain, and swollen testicles. Gonorrhea can also occur in areas such as the anus and the throat. If you get gonorrhea in the throat, you may experience itching in the throat, sore throat, or trouble swallowing. If you also get it in the anus, you may have itching and pain during poop. How long does it take to have symptoms of gonorrhea? Usually, because it is asymptomatic, you may have gonorrhea and may not show symptoms for several weeks. The immune system may not recognize the gonorrhea right away as an infection when it enters the body. On average, however, most people show symptoms within 14 days or 2 weeks. Gonorrhea is contagious and spreads easily through sexual activity, but not all intimate acts or body fluid exchanges put you at risk for gonorrhea. For instance, you can get gonorrhea from kissing, holding hands, hugging, sharing foods or drinks, or even using the toilet after someone else. You are at a greater risk for gonorrhea if you are under the age of 25, if you are sexually active and don't use condoms during sexual intercourse, if you have a history of STIs or have multiple sex partners, also men who have sex with men, or those who engage in multiple sex, especially with those who haven't tested for gonorrhea yet. Gonorrhea can cause serious complications if it's left untreated. If it spreads throughout the body, it can cause swollen and painful joints, liver inflammation, heart valve damage, and also brain damage. Complications in women can cause pelvic inflammatory disease, that is PID, which can also cause infertility and ectopic pregnancy. It can as well cause eye problems that may lead to blindness in infants who are born to untreated birthing parents. Complications in men may include infertility, scars in the urethra, testicular inflammation, prostate pain, or prostate inflammation. If you are infected with gonorrhea, you may need antibiotics to treat it. Your healthcare provider or your doctor will determine which treatment plan best suits your situation. Your partner or your partners may also need the treatment too. Can gonorrhea be cured? Yes. You just have to make sure you take all your medications as prescribed and directed by your physician or your healthcare provider. Medication should be completed. It should be taken and completed even if symptoms start to improve in the course of taking the medication. And also remember not to take someone else's medicine to treat your illness. How do we prevent gonorrhea? The only way is not to have sex. And so if you want to engage in any sexual activity, you make sure you employ the use of condoms or dental dams. Do not have sex with someone who has gonorrhea symptoms, and also limit sexual partners. Now, what happens when you have gonorrhea during pregnancy? If you have gonorrhea during pregnancy and you don't report, what happens is that your baby, your unborn baby, may be at risk for complications such as low birth weight or blindness. And that is why it is crucial for you to report such symptoms to your healthcare providers so that they will help you with the right testing and treatment to keep you and the baby safe. Can you have sex after gonorrhea treatment? Typically, you have to wait for at least a week after you and your partner or your partners have finished all your medications before having sex. Gonorrhea is a very common STI, but it doesn't mean it's not avoidable. It is avoidable. The only way to avoid it is to make sure you protect yourself and then get tested for the infection. Safer sex is very important when it comes to gonorrhea since it is asymptomatic. And if there's a chance you've been exposed to the infection, don't let embarrassment prevent you from reaching out to healthcare providers. Untreated gonorrhea can cause long-term damage to your health. You don't have to face all these complications, especially when a simple course of antibiotics can cure the infection for you. So don't ignore the symptoms of gonorrhea. Let us know about it and then we'll guide you accordingly. This is Time with Nurse Joyce. Like and share the video for me. Subscribe if today is your first time, and I'll see you in my next video.